everyone, my name's Renee and I am one of the lab assistants here in the clinical lab here with CCRM Colorado, and I am here today to chat with you a little bit about using our shipping kits to send back your core communicals and or your day 3 blood work. So just know everything I talk about is written in the instructions that come in the kit, so I don't want you to feel like you have to write anything down. I am just simply giving you a visual so it's easier for you to follow those written instructions. So let's get started. So whether you take our kit home with you or we ship it to you, it's going to arrive at your house with a brown box around this one. Everything's room temp now, but there are some things inside you're going to need to freeze. So we do want you to go ahead and open it up once it makes it to your home. Go ahead and open it up, toss the outside brown box. You're left with this one. Don't toss this one. This is the actual kit, and it already has a prepaid FedEx air bill stuck to the side, ready to head back to us. Now when you open it up, those instructions are going to be sitting right on top. So the first thing those instructions are going to tell you to do is open it up and pull out all 5 freezer bricks. So there's 5 of these in there. I'm not going to pull them all out, but you're just going to stack all of those freezer bricks up in your freezer. Next, it's going to tell you to pull out box number 1. So it's labeled with number 1 right on there. And it's going to tell you to pull out the StarStet Cool Transport Container. If I can get it out of there. And you're also going to want to freeze this, and it's going to tell you to do that as well. So all 5 freezer bricks sit in your freezer, the cool transport container sits in your freezer, and you do want to make sure this is lying flat so the liquid freezes all the way throughout there. Once it's time to get you, and this is just going to sit in your freezer until it's time to get your blood drawn. So when it is time to get the blood drawn, just pack it all back up. You're going to bring the whole kit with you to the lab, including the instructions. So everything goes with you to the lab. From there, they'll take over, and their instructions are in there. So you don't have to tell them, but their instructions are in there as well. But what they'll be doing is drawing 1 bundle per patient. So this bundle of tubes are in there as well. And they're going to be drawing 1 bundle for you and 1 for your partner. If it's just you being drawn, of course, it's just going to be 1 bundle being drawn. They'll be the one to draw the blood, let it clot, spin it down, pour the serum off into here. From this point, and this is what we get back, this is the only thing we get back, these clot tubes will be thrown away. So from this point, the lab is going to say one of 2 things. They're either going to say you have to freeze and ship, or they have to freeze and ship. If they're freezing and shipping, pay them a draw fee and walk away, you're done. If you're freezing and shipping though, just know that is fine as well. And they'll probably tell you to come back in about an hour to pick it up. It takes about that long to get it down to serum. So once you come back to pick it up, you're just going to take everything home. Nothing gets shipped yet. So you just bring everything back home. You're going to put those 5 freezer bricks back in your freezer. You're going to put the StarStet Cool Transport Container back in your freezer. And then you're also going to freeze the serum tube. Everything's separate right now. The next morning, this will be frozen. Then it goes down inside of here. Don't put it in here ahead of time. It has to freeze separate, and then the next morning it goes in here. At this point, as long as it's Monday through Thursday, pack it up, ship it off, you're done. If it happens to be Friday, Saturday, or Sunday though, you can't ship those days. We need to get it the very next day, so we don't want you shipping Friday, Saturday, or Sunday. So if that's the case, we still want you to put it in here the next morning, but then pack it all up in the styrofoam and put it in the back of your freezer, and the freezer bricks can stay in there as well. Putting this in the styrofoam and back in the freezer in the back of your freezer will keep it nice and safe if there happens to be a thaw cycle in your freezer over the weekend. And then on Monday, pack it up and ship it off. Now packing it up and shipping off is as simple as literally putting everything back in, taping it up, and taking it to a FedEx station. I did want to mention though, there is a spot where it says place from label here. That from label is going to be in your instructions. You'll just pull that out, fill out your name and address, and stick that right there. So once you've taped everything up, you have a couple of ways to get it to us. You can either take it directly to the FedEx station. It does need to be an actual FedEx station, not a FedEx office or Kinko's or Walgreens drop-off. Those places could tell you no, and because it's a biosample. So it does need to go to a direct FedEx station. Or you can call FedEx and schedule a pickup, and they'll pick it up directly from your home, from your office, from a friend's home. You can schedule that pickup at no extra charge, and that's 1-800-GO-FedEx to schedule that pickup. And then from there, you're really done, but you do want to make sure it made it to us. So the next day, and we usually get our kits about 12 o'clock Mountain Standard Time, give us a call, make sure it arrived. At that point, we can ask you any questions we may have, and then if it didn't arrive, that still gives us time to track it and make sure it still arrives safely before it thaws. So that's really important that you give us a call that next day. And of course, at that point, you are done. Now there are lots of questions that come up from patients, so I wanted to go ahead and get some of those answered for you. If I don't answer your question, again, please make sure you give us a call. But the one that comes up the most is, where do I go get my blood drawn? So I'm going to start with where you shouldn't get your blood drawn. So LabCorp and Quest, just know they're going to tell you no. They have flat out told us they will only do it if they can run the test, and that is not an option. So LabCorp and Quest are out. As far as places to go though, CCRM locations, if you have one near you, feel free to use them. Local hospital labs, local fertility centers, your OBGYN or your primary care physician, they're also an option as long as they have a centrifuge. They should be able to do it for you. There's also a place called Any Lab Test Now. They're all over the country. If you have one close to you, feel free to use them, and I would definitely suggest it. They're super easy to work with. Also keep in mind you can be drawn on day 2 or day 3 if you're doing day 3 blood work, whichever works best for the lab and for you. But just know we'll always call it day 3, but those levels are the same, so it's absolutely fine to do day 2 or day 3. Now, as far as what you'll be telling the lab, so as far as what you tell the lab is you're simply looking for someone to draw your blood, process it down to serum, and either freeze and ship for you or give it back to you to freeze and ship. If they give you an option, just know it's fine either way. You can do the freezing and shipping or they can, it makes no difference to us. At this point though, when you're asking them this, if you know for sure and they've told you you have to do the freezing and shipping, you really don't have to bring this entire kit with you to the lab back and forth. If that's the case, you really only need to bring the bag of tubes and your instructions. And then when you come back to pick up that serum, you would just take everything home, and at that point your freezer bricks and that StarStep cool transport container is still in the freezer, and then you would freeze your serum tube according to those instructions that we went over earlier. So that's kind of what you're going to be talking to them on the phone. Please don't show up without calling ahead of time. There's a good chance they'll tell you no, and if it's day 3, it can cause a little bit of stress as for trying to find a lab right away that will do it. Not all labs will do this. As far as how long you can keep the kit, there's no real set time, but if you do have it longer than 3 months, we do ask that you give us a call. There's a couple things inside the kit that could be expired. The tubes have an expiration date on it, and that cool transport container have an expiration date on it. So if you have it longer than 3 months, just give us a call. We can walk you through on where those expiration dates are. If you return it because you didn't need it, if you get it back to us on your own dime, we certainly can get you a refund of $100. So you can either ship it back to us, just USPS or UPS or whatever it may be on your own dime, or you can bring it back into CCRM Colorado location at your next appointment and just hand deliver it to us. That's fine too. But do know, if you use this label that's already on here, there is no refund because that means you use the cost of the kit. And really that's the only questions I can think of offhand. Certainly if you have others, don't hesitate to give us a call. We're here to help. And just thank you so much for viewing our video. Our phone number here is 303-788-8300, extension 1770, and that number is also in the instructions. Thank you so much. Have a great day.